So in the past, I've told stories about how broken our healthcare system is through personal experiences I've had with the healthcare system. Of course, many of you remember the appendectomy incident, which I described in the YouTube video titled My $27,495 Appendicitis. That was a doozy back in late 2019. There was also what we now know of as the podiatry debacle. That was earlier 2019. You can hear about that in the YouTube video titled My $829 10-minute long doctor's visit. I have a new one for you today. This one comes to us from the world of otorhinolaryngology, as many of us know it, ear, nose, and throat medicine. Now, I'm not telling you this so that you as a European viewer can write to me and say, David, this would have cost me $0 out of pocket in my country, or David, this would have been $20 in my country. I know that. Please don't email me about it, okay? It's a look into our healthcare system. I know how well yours is working. I don't need you to tell me, David, that would have been free out of pocket for me. So I, as a self-employed person, get my own health insurance through what are called the exchanges. And for years, I've had what is called a silver level plan. Now, the gist of how this works is, bronze, silver, gold, platinum. The higher you go, the more you pay each month. But in theory, the less you pay for services as you use them in terms of copays and deductibles. So like a bronze level plan would be cheaper monthly than my silver plan, but it would typically have a higher deductible and a higher copay that needs to be met, the higher deductible that needs to be met before the insurance will cover anything. Silver plans cost more, but they cover more. Gold and platinum, you might end up paying $1,000 a month for a single person, but you might have really, really cheap or no copays. Okay, fine. I've had a silver level plan for years, and my premiums have dramatically increased, as have my copays. So for the same plan over the years, in 2018, I was paying $439 a month, and my specialist copay was $40. In 2019, it went up to $454 a month, and my copay went up to $50. In 2020, I was up to $478 a month, and my copay was up to $70. And this year, I am paying $520 a month, and my copays are up to $75. So right now, I pay $520 a month. That's $62.40 for the year, just for the coverage. That's if I use nothing. I guess I get an annual physical for that. Right now, I am paying that if I don't avail myself of any services. But I'm aware that for lab work, like blood draws, MRIs, CAT scans, I have a $2,000 deductible to meet. I have to pay the first $2,000 for that type of labs and MRIs and that type of thing before my insurance will cover anything. So I've been having some ear pain. My dentist thought it was caused by clenching my jaw at night, might be a TMJ type of thing, but it's been going on for a while. So eventually my doctor said, go see an ENT to rule out other things. So I'm thinking, great. I pay $520 a month for insurance. I know my specialist copay is $75. I make an appointment. I get a referral. I confirm this doctor is in my network. I'm good to go with my $75. I go last week. Doctor looks, says, things look good. Let's do what's called, I just want to look in your throat. Let's do a laryngoscopy, meaning they put a camera into my throat through the nose. I don't recommend it. It's not fun, but okay, it was medically what my doctor wanted to do. Let's do an audiometry workup to test your hearing and make sure you don't have like a eustachian tube issue. I say, sure. Now, this is all stuff that was done in the office. So when she suggests it, I say, yeah, let's do it. I'm here. Let's do what you want to do. So everything looks fine. It's probably TMJ from clenching at night. I've got a diagnosis. Fantastic. I pay my $75 and I go home. I now get a bill saying that this was a $1,033 visit and I'm going to owe almost another $500. And I say, wait a second. How can this be? I paid my $520 for my insurance. The doctor is in network. I had a referral. I paid my copay. I don't have a deductible for specialists. How do I owe another $500? Well, I look closely at the bill and it says, that's right, David. The office visit was billed at $420, typical for specialists. You paid your $75. My insurance, good for them, negotiated a discount, so they add another $92, and the office visit is paid. But then, here we go, that camera in my throat for 30 seconds, that's another $400, David. The audiometry, that's another $140. The tympanometry, which is 5 seconds to check the pressure in my ears, that's another $50. And lo and behold, that's billed like a blood test. That's billed like an MRI. So even though I'm in a room with the doctor and she looks in my ears with one tool and looks in my nose with another and then puts in a camera, the camera is a completely different type of thing. That is like lab work or an MRI or blood work. And I need to meet my $2,000 a year deductible, which of course I haven't met because it's March. Now, thankfully, my insurance did me the favor of negotiating better rates. So even though the camera normally costs $400, they've negotiated it down to $280 for me. The hearing tests, they've negotiated down to $110. So bottom line, in addition to my $75 copay and paying $520 for a month of health insurance, I owe an additional $466. In essence, if I didn't have any insurance, I could have said, do you offer a cash discount? I might have paid a little more for some of these items. I probably can't negotiate as good a rate as my insurance company can, but I would have avoided paying the $520 a month in premiums all along. So needless to say, I'm thinking about maybe I switch to something called direct primary care, and then a high deductible plan and kind of self-insure for the higher deductible. It's a mess. If you're in Europe, don't email me. I know this would have cost you nothing out of pocket. You don't need to make me feel any worse, but that's another bit of insight into the American healthcare system. If you are anything like me, you probably aren't thrilled with the idea of going into a doctor's office right now. And thankfully, there's a practical and affordable way to take control of your health and get personalized care from the comfort of your home. It's a service called SteadyMD. They're one of our sponsors. You take a quiz, you get matched with a licensed primary care physician who understands your health needs. You have a 1-hour video call with your new doctor. You establish a meaningful relationship with them. And after that, your doctor is available to you anytime by text, phone, or video chat. This is not a random doctor on call. Each doctor at SteadyMD has a limited number of patients, so they actually have time to listen to you. You get the personal attention that you deserve. They can do almost everything an in-person doctor can do: perform medical evaluations, talk to you about health concerns, send prescriptions to your home or local pharmacy, and anything they can't do online, they'll quickly set you up with an in-person provider to do, things like blood tests as an example. You don't need insurance. It's only $99 a month with no other fees or copays. There are so many practical advantages to using SteadyMD for primary care, and it's also so much more affordable. Go to steadymd.com/Pakman to take the free quiz, see which doctor is right for you. I took their quiz. They matched me with a doctor who specializes in my particular health needs and situation. The doctor they gave me is a really perfect fit for me and my medical needs. There's no risk, no commitment to get started. Just click the link right underneath this video.